Hello, this is Efren Colasso for the audio report assignment for the HLAT 760 evidence-based interventions of upper extremity. Uh, we are here to talk about the optimal outcome model. This is a rehabilitation model that we can use uh, to try to create a complete rehabilitation program that can address different aspects that are important to address to have better outcomes in the rehabilitation process of our patients or our athletes. Well, I think this model will clinically fit a lot in my clinical scenarios. Basically, with this model, one of the things that I really like is that we are adding to the mix the patient values. Not only we are gonna try to fix or to work the clinical problems. Uh, Instead of that, we are also helping the patient, seeing him like a human being, not only as a subject. And by knowing the things that the patient wants to accomplish in the program, well, we can establish goals that are related to that, and we can work that through a process. And at the final of our program, if the patient is happy, feels that he or her has accomplished her mission or her goals, well, we can be sure that we have done a great job, and we have helped him or helped her to return to sports uh, in the best way possible. Uh, Related to the external factors, this is very important because we are going to work with the things that they're gonna improve the athlete or the patient in the scenario that they want to develop. Uh, in the case of sports, if the patient or the athlete knows that has some deficiencies in her skills or on the way that the things that they have to be better, to be a good players, well, we using this model, we can establish some goals to work with that at the same time. Basically, these two components, they are added to the traditional model, that is the clinician standpoint, in where we address all the anatomical problems or different factors that are uh, the factors that they are related to the injury. But I really like too that this model help us to see the anatomical problems not only just as tissue. Uh, Instead of that, this model help us to know or to learn how to integrate that the functionality part, that is very important to understand every case, and not only address the tissue that is injured. Instead of that, we are also analyzing other different aspects uh, that may be a contributor to the injury, like biomechanical problems, functional problems. So definitely, this model is gonna help me to do a better job in my clinician. I think they're gonna help us to establish better our goals. Basically, with the short-term goals, we work mostly with the anatomical part, with the promotion of healing of the tissue, and now with the integration of these external factors and the patient values, maybe we can have a better, most better long-term goals, in where we are not only promoting healing, at the same time we are going to try to do something that the patient or the athlete is better in her sport, in their sports, or in their activities. I think this is a balance. Trying to be in the center of the model is gonna help us on how to address the situation. Maybe also understanding these other external factors like coaches values, the way the time that they have to come to treatment, other things that we can improve, or we're going to try to do to improve those aspects. So definitely this model is a real good one. I really like it. For me, in my case, that I'm in a scenario where we have to work everything as fast as I can, like magicians. Uh, Definitely this model is going to help me to demonstrate to the patient how is the better way to correct all the problems. I can now have a model that I can use as an education standpoint, in where I can demonstrate, well, if you want to be better, if we want to do the things at the best, this is a good model in which we are going to try to have a balance between these three aspects. And at the final of our program, you're going to appreciate what we have done, because this is a good model to integrate those aspects as a whole one model, and definitely we're going to help you to do better in your activities. Well, this is definitely a great model, and I definitely would integrate in my clinical scenarios. Thanks.